Good evening and welcome to the May meeting of the Pitt County Board of Health. I'd like to start out by asking, are there any public comments tonight? Okay, hearing none, let's move on to the minutes of the previous meeting. Those have been circulated among the board members. Were there any corrections or additions to those minutes?
No.
Hearing none, is there a motion for approval?
So moved.
Second.
Any further discussion? All in favor say aye.
Aye.
Any opposed? Okay, the minutes are approved. So we'd like to move on to the fiscal report. Marcia?
Everybody. The fiscal report, we're reporting for the period 10, which is April, ending April 30th. We did have 3 budget amendments. There was an increase in state funds that was added to our budget of $7,040. We did have a $16,000 decrease for the opioids. That is a pass-through contract that we have with EChem. However, that $16,000 will be added to our next year's state budget as of June 1st. The state is allowing us to shift some funds for that initiative. If you will see with our year-to-date, we are running a deficit of $305,106, but with our timing items, such as our Medicaid cost study, our state funding for what we spent in April that will be pulled down in May, and then our county funding appropriations for this period, we will have a surplus of $593,000. Are there any questions about April?
Okay, sure we don't have any questions tonight.
Yay, okay. I would like to finally report that we have finalized our Medicaid cost study for 17-18. That was filed with the state. It took us a while, but we really looked through it. We were very thorough with it. We should have the settlement soon in the next few weeks, hopefully.
All right, very good. So we need to go ahead and approve this budget report. Are there any further questions? Okay, Tina's made a motion. Is there a second?
Second.
All right, Rex, any further discussion? All right, all in favor say aye.
Aye.
Any opposed? All right, thank you very much, Marcia. We appreciate all the hard work.
Okay, I just want to mention one other thing.
Okay.
Amy Haddam and I presented our budget, our 1920 budget, to the county commissioners on April the 4th. We did formally ask for the 4.40 FTE positions. The overall total request came out at $12,011,767, which was a little bit more than what I presented to you initially, because $74,882 was actually part of a payroll accrual that the auditors are making the county office put in. I just wanted you aware of it, so if you saw 12 million on anything, that it was some accrual numbers.
Okay. All right, when do we expect to hear anything back? Any questions from county commissioners and Scott? Don't know.
Scott's still holding to the fact that there was about $16 million worth of asks, and the new money that we have, which is it's something shy of about $1.5 million, is just barely enough to actually cover the additional monies that the state of North Carolina is asking for, retirement programs, things like that. So, as usual, the county is not flush with money. It's tight. So whether there's any movement, I don't think there's going to be. I think that what he's recommended is probably where it's going to pretty much stay, which is not everything that this board would like to see.
Yes, sir. All right. Well, we appreciate all the support you can give us, so, as always. All right. Any other comments? Or?
We do have some position, but I'm going to let Amy Haddam discuss that a little bit later.
Thank you very much, Marcia. Appreciate it.
Thank you.
Okay, the next item is under old business. We have some good news that was reported last week in a press release on the 7th, and went to the very nice article in the Data reflector the following day that Dr. John Silvernail has been hired, has accepted our offer to serve as the next health director to succeed Dr. Morrow, who retired back in December. Dr. Silvernail is a known entity here. He's worked for the Brody School of Medicine and served as the medical director of Vidant Occupational Health for the last 7 years. Has a master's, he's from New York, has a master's of public health, preventive medicine degree from University of Albany School of Public Health. He worked for the state health department in New York, and so he's had interest for a number of years to serve as a health director, and he hoped to do it in New York, but the job at Brody and Vidant drew him down here, and we're pleased that he's here. I've worked with him very closely for the last 7 years. Part of my job overlaps with his, and so very pleased that he's going to be joining us on July 1st. So thank all the board members for all the hard work. Jobs were posted toward the end of 2018, and then we considered a number of candidates, physician candidates, certainly were at the top of our list. And I'd like to particularly thank Commissioner Colson for his support with the county commissioners. Essential that we had their support. Mike Taylor, Florida Hardy did a tremendous amount of work behind the scenes, and we appreciate y'all doing your homework and responding to all of our crazy questions that we had. And certainly to Amy Haddam for all of her work that she's done, and Jennifer Dickerson back there. So it's taken a team effort to get everything put in place. We're very pleased to have Dr. Silvernail joining us. So I think he'll do a great job, and I think citizens of Pitt County will be very well served by Dr. Silvernail's hire. So again, thank the board for all your hard work and patience during this time. Let's see, the next thing, we had made a motion, Dr. Hayes, I think, had made a motion regarding substantial equivalence. Amy?
Yes, in your packets, you'll see that there's a memo that was sent to Scott Elliott, our county manager, Mike Taylor, deputy county manager, and Florida Hardy, our human resources director, asking for more information about what it would take for us to move to from under the State Personnel Act to become substantially equivalent. And this stemmed from a conversation regarding our nursing vacancies, wanting to know more about Pitt County's hiring practices, and also a conversation about staff salaries and were they comparable to other counties. So a motion was made for us to pursue becoming substantially equivalent, and I started researching it some, speaking with Mike Taylor about it, Florida Hardy, and there's a lot to learn about that. So I've asked Florida Hardy if she will come in June to present to this board what the steps would need to be taken in order to pursue that, and even if you really want to do that. So she's agreed, and she'll be coming to the June meeting to provide more information about that.
And just to let the public know that the idea here is that some of the salaries, over time, salaries slip, and so the Pitt County Board of Health in some areas has not been as competitive as we'd like for them to be, certainly in comparison to, say, the Brody School of Medicine or the hospital of Vidant. So it's an effort to try to improve our ability to make our salaries more competitive and continue to retain good people and hire more good people down the road. So does anybody have any questions for Amy about this? All right, we'll move forward and look forward to Florida's presentation next month. Amy's going to update us on the nursing vacancies.
Yes, a lot has happened as far as working towards trying to fill our vacancies, and I do want to commend Dr. Kimberly Hardy for moving forward with this. Myself and Jennifer Dickerson, who was over HR within the health department, and Marcia Hall, and Dr. Hardy, we all met and tried to come up with a plan to make our positions more marketable to nurses. And Dr. Hardy reworked our organizational chart several times to see what would be the best plan for us to recruit new nurses. And one of the things that we came up with, we worked with county HR to do what's called a work against, where we can get individuals to apply that might not normally qualify. They may not have enough experience to qualify for the position as it is classified. So we have advertised all of the nursing positions. There are 6 of them that are open right now. They've all been advertised as a work against status, and hopefully that's going to bring maybe some newer nurses that maybe not have as much experience, allow them to apply, and maybe we can get them in the door, get them used to public health and love it like we do, and help them move on up to a higher classification as they get that experience. So I do want to commend Jennifer Dickerson for getting those positions advertised. Like I said, we do have 6 that are out there now, and hopefully we'll be very busy pretty soon trying to do some interviews for those.
Very good. Any questions for Amy? We appreciate the hard work behind the scenes on that. And then finally, the reaccreditation.
Yes, our reaccreditation status is final. Myself and Jennifer Hardy, who's the backup accreditation coordinator, and Jennifer Dickerson, representing personnel, we all went this past Friday before the accreditation board to answer any questions they may have before they finalized our accreditation status. We did receive this nice plaque that shows that we are a reaccredited agency, and we also received a blue ribbon showing that we received accreditation with honors, that we met all of the 147 activities. So I wanted to share that. So it is final. I want to commend all of our public health staff, Board of Health, because without all hands on deck, we would not be able to have achieved that status.
Very good. Great work by the whole team. So congratulations and thank you for all the hard work that's been done. Okay, let's move on to, is there any other old business? Under new business, special employee recognition. And some of this has already appeared on the Facebook account, I think already, but we'll talk about it again tonight so that the public can share in the news. So bear with me just a minute here.
Remark.
You have it here? Okay, here we go, sorry. Okay, very pleased, Mark Phelps is here tonight, and I'd like to recognize him. He was awarded the Environmental Health Supervisor of the Year Award. These details about his background and award were posted on the county website and also on our Facebook page. At the annual spring education meeting held April 24th to 26th, North Carolina Environmental Health Supervisors Association named Pitt County's Mark Phelps as the Environmental Health Supervisor of the Year. He was nominated for the award by his staff, so it's always great to be recognized by the folks that you work with every day. And he's currently the Pitt County Environmental Health Director. He's held this position since September of 2014. Prior to that, he was recently served as on-site wastewater supervisor in the Environmental Health Division of the Pitt County Health Department, where he was hired in October of 1994. So he's been with us quite a while. The Environmental Health is a division of the Pitt County Public Health Department responsible for monitoring and regulation of several public and private services offered to the public, including food, lodging, and when you see those scores when you go to restaurants, Mark is over that area. Institutional sanitation inspection, mosquito management control, on-site sewage disposal regulation, and regulation of public swimming pools and spas, among several others. So we'd like to recognize Mark. He got a beautiful plaque. I'm sure he's too modest to bring it with him, but certainly was awarded with a very nice plaque in addition to the award. So Mark, congratulations. We're glad you're with us. Do you have any comments tonight?
No, sir. We'll just say it's a very humbling experience when you go in front of a group like that and your peers recognize you with an award like that. I think it's probably the highest honor I can imagine. But I'm blessed to work with a wonderful staff. I think we probably have one of the best environmental health programs in the whole state, and that makes my job a whole lot easier.
Yeah. Well, again, congratulations. Real proud of you. Okay, let's see. We'll talk about, the next item is the Youth Development Program presentation by Vashti Cottrell. She serves as our Youth Development Program Coordinator for the Pitt County Health Department. Spends most of her time working with middle and high school students, helping them to set career goals and to prevent adolescent pregnancies. Tonight, she'll provide an update about this program. So, welcome.
Thank you. Good evening.
Good evening.
As you said, I'm Vashti Cottrell, and I'm a public health education specialist at the health department. I've been there about 18 years working this particular program, still enjoying what I do. So I'm pleased to be here tonight to share and introduce to you all the youth development program and the strides we've made over the years. And the timing is perfect because May is National Teen Pregnancy Prevention Month. And this month is set aside to celebrate the progress we made in teen pregnancy prevention and to also encourage the engagement of youth, families, and communities in implementing programs that have been proven to work and continue to work to develop new and innovative approaches. So we continue this, what we're doing as far as bringing the teen pregnancy rates down. So I want to start by presenting a couple of facts. So the teen birth rate in the United States is at a historic low. I'm going to show you some of those numbers in a minute. But we still, as far as the United States, we're still the highest compared to other developed countries. About 4 in 10 teenage girls become pregnant before the age of 20. Over 80% of teen pregnancies are unintended or unplanned. About 50% of all high school students have had sex at least once, and about 3 of 4 girls report that they have sex because their partners want them to. So these are some of the issues that we tackle when we talk about teen pregnancy prevention amongst our teenage population. So who does teen pregnancy affect? It's important that we understand that teen mothers and children are just the start of the teen pregnancy impact. Entire families, communities, and schools and health systems are affected. This impact goes beyond the 9 months of pregnancy and also beyond the childhood years. The impact has multi-generational effects, which gives meaning to the term when we say breaking the cycle. So the relationship between teen pregnancy and public health, it is a public health concern as it's associated with the outcomes of consequences of young motherhood. Some of these would include increased risk of poor social, economic, and health outcomes for both the mother and the child. This is the reason why teenage pregnancy is an important public health issue, because it takes an integrated action across several sectors that's needed to help young women avoid unwanted pregnancy and to deal with the consequences of pregnancies, whether it was wanted or not. Only about 50% of teen mothers actually receive a high school diploma by 22 years of age, and about 90% of women who do not give birth during adolescence actually graduate from high school. As far as education, we know that teenage mothers are more likely to have lower school achievement, and they're more likely to drop out of high school. They're also likely to have a lot of health and medical problems too. So some of the risks that are associated with lack of prenatal care, because being a young mom, sometimes they may not receive prenatal care, which this sometimes may lead to low birth weight, which is right along the lines of giving birth to premature babies. They may experience slight birth anemia, high blood pressure, or pregnancy-induced hypertension, and it's also related to higher rates of infant mortality, which is the death of a baby before it turns 1 year old. And when we look at economic costs across our nation, the $4.4 billion is the amount of public savings each year that's associated with the significant declines in teen child childbearing that have already taken place. So we've saved about $4.4 billion due to the number of teen pregnancies that have gone down over the years. And we could save an additional $1.9 billion if all teens were able to avoid unplanned pregnancy. So one of the misconceptions about teen pregnancy for a lot of people is that it's somehow a recent epidemic, which is very far from the truth. So I want to share with you the trends that we've seen over the past couple of decades and take you back and then bring you back to the present. So it wasn't until the early 80s that national and local attention was given in response to the rise in teen pregnancy rates. So it was in 1980 that we saw 25,199 babies that were born to teen moms in North Carolina, which was a pregnancy rate of about 95.7 per 1,000 girls. Well, it wasn't until 1990 that the rate hit its peak at 105.4 pregnancies per 1,000 girls. So that was pretty high. So it got a little bit better because in the early 80s, a lot of organizations began to form in response to this. One of the main ones was what we call the Adolescent Pregnancy Prevention Coalition of North Carolina, which has not too long ago been renamed to SHIFT. This was founded in 1985. This work group kind of got together and started putting together efforts to help local communities deal with the teen pregnancy rates. And then in 1986, the North Carolina General Assembly launched a state-funded partnership to support pregnancy prevention projects across the state. So some of the organizations that were formed, as I said, was Adolescent Pregnancy Prevention Coalition, which is now SHIFT, but there was also the Advocates for Youth, which came a couple of years later, and then there was the National Campaign to Prevent Teen and Unplanned Pregnancies. Well, then, in the mid-1990s, the General Assembly passed a new law. This was called the Abstinence Only Until Marriage Law. And it was after this particular law passed that we actually then started to see an increase in pregnancies again between the years of 2003 and 2007. And just to show you this, to distinguish between abstinence only until marriage, there's an abstinence only education. And that's the term we use for sexuality education that only focuses on sexual abstinence. But abstinence only to marriage is the term for programs that focus on abstinence, but in addition, they focus on saving sex also until marriage. These programs particularly had a reputation for providing sometimes a lot of medically inaccurate information and sometimes deemed to be a little bit harmful. So then, as a result of the teen pregnancy rates going back up, in 2009, the North Carolina General Assembly came back and passed what we call the Healthy Youth Act. This was House Bill 88. And for the first time, public schools were mandated to provide students with health information that was medically accurate and age appropriate. This particular law gives local school boards a broad authority to be able to use proven curricula, meaning science-based or evidence-based curricula, so that they'll be able to provide a full range of parent and science-supported information. So as of today, each local school system, is required to provide reproductive health and safety education. They have to provide an opportunity for the parents and guardians to review all materials, and then the mechanisms for parents to either withdraw or consent to their child's participation. This is what the schools should be teaching along the subject line. Abstinence as an expected standard for school-aged children. They should be teaching strategies to be able to teach youth how to deal with peer pressure, reasons, skills, and strategies for coming and remaining abstinence, and also monogamy and medically accurate information when it comes to STDs, including HIV. Also, the effectiveness and safety of all FDA-approved methods of risk reduction, including contraceptive methods. Available local resources for testing and treatment. They should be teaching the HIV and STD rates, the prevention of sexual assault, sexual abuse, and risk reduction, and also building healthy relationships. Which brings us to the great news, in which the most recent numbers we have is 2017, is that North Carolina teen pregnancies hit the record low for the 10th consecutive year. So we're very excited and proud about that. When we look at North Carolina statewide, there were 8,849 girls between the ages of 15 and 19 who experienced a pregnancy in 2007, compared to, if we look at 1990, where we saw the peak, 26,204. And the current rate now of 26.7 pregnancies per 1,000 girls, compared to 1990, when the peak was 105.4. And that is to show how much progress we've made down through the years when it comes to preventing teen pregnancies. And with this new decline, the state's teen pregnancy rate has fallen more than 70% since 1990. And of course, we can't leave Pitt County out. We need to show those numbers of what we're doing here. And what you see highlighted in the red is actually when Pitt County saw its peak, which is in 2009, when we were at 48.2 was our rate, which is a little bit lower than the state's rate. And then we had about 355 pregnancies also during that time in 2009. And if you see now down here in 2017, we went from 355 to 152 for the year 2017. So what do we attribute this to? So researchers say this is due to the increased use of birth control, and particularly highly effective methods of birth control, long-acting like the IUDs and implants. And also, this is also due to a slight increase in the average age when teens first engage in sexual intercourse. So they're delaying the time when they're experiencing sex for the first time. So when we talk about prevention, they come into three categories. They're primary prevention, secondary prevention, and then tertiary prevention. Primary includes postponing first intercourse. It includes educating youth on the different risks and consequences of sex, making contraceptive and emergency contraception easily available. It also involves having parent involvement and youth development activities. Secondary prevention involves encouraging teens to use contraceptive consistently and to detect pregnancy early, providing services when they do become pregnant, promoting early prenatal care, and providing support services to prepare teens for becoming a parent. And of course, the health department, we provide the primary, secondary, and tertiary, which leads me to the tertiary prevention. Here we counsel teens they need to be counseled about the available options, including keeping the baby, adoption, or abortion. It includes having programs that prevent future unwanted pregnancies while also helping these parents and teens find the best child care. It involves providing them with parenting classes and having services to help them complete their education. It also means providing well child care, nutrition, and immunization services. Which brings to the program that we offer, the Youth Development Program, one of the programs that I coordinate. And this program falls under one of the primary prevention, in which it's a collaboration where we involve both parents, the schools, and the community. And our main goals are, first of all, to prevent or reduce any risk factors that are associated with teen pregnancy. And we want to foster a positive and healthy development among the identified youth who are in the program. And then we want to expose students to a broader community and be able to introduce them to new resources and opportunity. It is designed to provide the adolescents with social support and guidance, life skills training, and positive and constructive alternatives to risky behaviors. In addition, we provide opportunities for meaningful contributions to the community. So the components of our program, we have a 7th, 8th grade support groups that we do in the middle schools. Then there's a high school peer health program, and then we have parent involvement workshops. Each year we try to serve at least 4 middle schools where they recommend, and I would like to use the term at-risk, but more vulnerable children to the program, because personally I feel all teens are at risk to some degree. So they identify students who they feel will fit best with what we offer. So in the 7th grade support groups, what we do, we have group lessons where we have discussions that talk about some of the topics I just brought up earlier. They're also involved in volunteer service projects. This is important because it's been proven that involvement in volunteerism increases young people's self-esteem. The picture you see there is actually one of the groups from Farmer Middle School who recently went to the food bank to volunteer. We do the Baby Think It Over program. If y'all see the mechanical babies that high schools use sometimes, we actually incorporate that with our 7th grade, which the program actually recommended that it start at 7th grade. This is important because it gives parents an opportunity to start conversations about the topic when they bring the babies home. Parent permission is required. It's also voluntary, on a voluntary basis. Even though teachers or counselors may refer the students to the program, they have to want to be there. So it's on a voluntary basis with parent permission. At the high school level, we do a peer-to-peer education where we actually train some of the high school students. I like to call them mini health educators, where they go out and plan programs and they act as community resource liaisons with their peers, where they're able to share information on different health topics, particularly teen health topics. They do presentations also, and the picture there that you see was a program they did last year in the month of May, because May is also Mental Health Awareness Month. And so they collaborated with the Boys and Girls Club, where they were able to go in and did a kind of a field day with the students there, where they focused on stress relieving type of activities with the students there at the club. We recently also had a collaboration with ECU Pediatrics and Dr. David Holder, who came aboard about 2 years ago. So he collaborated with us. He was able to get a grant where he provided a lot of resources for us to continue with the high school program. And then for the parent piece, we offer parent workshops. I'm sure you're all familiar with Triple P. About 4 times a year, all the parents of the students who are in the program are invited to attend the workshop where we do parenting support and offer parenting support through Triple P. And then if we offer additional programs throughout the year, a lot of parents sometimes volunteer and help out with the programs. Our evaluation methods for the program, we look at the retention rates. We want the students to be able to enjoy being in the program. And the retention rate is usually high. It's usually more than 90%. Usually a student only leaves because they move somewhere, so they have to kind of drop out because of that. We look at the number of pregnancies reported throughout the year. During the whole 18 years that I've been there, it's probably been less than 1% of young ladies gotten pregnant while they're involved in the program. That's not very surprising, because when we look at numbers, most of the pregnancies happen probably during like 11th and 12th grade year. So this is a good thing being in the program in middle school, because we're also preparing them for once they get to high school. We also provide pre and post tests to the students before and after the program to test their knowledge and skills that they learned during the year. And then we also get personal feedback from the students about how they felt about being in the program. We also have a presence and support through PIMPAC, Pitt Infant Mortality Prevention Advisory Council. We recently formed a subcommittee with PIMPAC because we all, as I mentioned earlier, teenagers are at high risk for premature babies, and so we want to be able to provide education and awareness with the support of PIMPAC to be able to offer more reproductive health awareness activities. We're actually in the process now, the subcommittee, of planning what we're calling the Traveling Interactive Health and Hygiene Fair. I had to think about it. Where the Boys and Girls Club are opening their door for us to come in and bring a fair with several employees at the health department to be able to come and offer a fair for the youth at 3 of the sites of the Boys and Girls Club here in Pitt County. So we're excited about that. That'll be taking place this summer. So funding support over the years have come from various sources. In the past, one of the main funding sources that we got that jump-started the program was TANF funds back in, I think when I started back in 2001. We've also received funding in the past from Women for Women of Pitt County, the Children's Trust Fund, and one of our continuous and faithful contributors have been Invited Medical Center from the community health programs. Are there any questions? I appreciate you
Does anybody have
listening.
any questions for Ms. Cottrell? Well, thank you very much. This is a wonderful summary, and we appreciate your presentation very much and the work that you're doing. So let us know how we can support you if, challenges come up,
Thank you.
as they do.
They do.
Thank you very much. All right, well, let's move on to the next is expiring Board of Health terms. I have just a couple announcements here. We're Dr. Lady Aycock, who's been our optometrist on the Board of Health for 18 years, so almost 2 decades of service. So we're very pleased with the service, and we're sad to hear that she's going to retire from the Board of Health, but we're most appreciative of the service she's provided. And so, as you know, there are certain, the public may or may not know, there are certain positions that we have on the board. We have a physician, a dentist, an optometrist, a veterinarian, engineer, nurse, pharmacist, and we can't forget, there's the engineer. And then, of course, Commissioner Colson is the commissioner, representative from the county commissioners, but we also have several at-large positions. So we have to replace or succeed Dr. Aycock with another optometrist. And so very pleased that Dr. Scott McIntosh has applied for this position as the optometrist representative. Now, are we to vote on this tonight, or is this?
He's had submitted his application, he's gone through
Okay.
the formal process, so it would need a vote so that we
Okay.
could contact him and let him know.
Okay. Each of you have a packet here. I don't know if you had a chance to take a look at it yet, but has indicated his interest, and we have Dr. Aycock stamp for approval. Is that what I understand? Okay. So, does anybody have any questions? He's a East Carolina University graduate, BS in biology. He was educated at J.H. Rose High School earlier, and has been working at Carolina Vision Care.
Need a motion to approve. So
Okay.
moved.
All right. Dr. Aycock's made a motion. Is there a second?
Second.
All right. Any further discussion? All in favor, say aye. Aye. All right. Any opposed? All right. Well, Dr. McIntosh is approved, and we will look forward to having him at a future meeting here to get him sworn in and all. So, and we'll do some special recognition for Dr. Aycock at a later time. So, thank you again for your 18 years of service, and I'm most appreciative. Let's see now, we also have some expiring terms coming up later this year. Nitesh Patadar is coming up, our pharmacy representative, June 3rd. Porter Stokes, at-large position, June 16th. And Tina Dixon, at-large, on September 1st. So the first thing, I think we talked about this a little bit informally before, but formally, Nitesh, would you like to continue serving on the board?
Be my honor to serve.
Okay, all right, very good. And Tina, would you like to consider service?
Yes,
I know you're busy, but with a
but I
lot.
enjoy this work too.
Very good, we appreciate it. So, all right, let's see, are these to be forwarded then to the county commissioners then for?
They will need to be, Betsy will handle that.
All right, do we need a motion for this, or no, it's just, I don't think we
Not-
voted on this previously. We haven't had a lot of turnover, but, okay. And I'll be in contact with Porter Stokes to see if he's certainly interested in continuing to serve. The rules and regs suggest that certainly it needs to be somewhere around 75% attendance at the meetings and all, so. All right, well, thank you very much. We're pleased that y'all are interested in continuing to serve, and then we'll find out about Porter. We included in your packet are 3 applicants who have indicated their interest in serving, and so once we find out whether Mr. Stokes would like to continue or not, then we'll discuss these at the next meeting. So, does anybody have any other questions about this item? Okay, the next one is plan for temporary medical director coverage. Amy informed me, and I informed the board last week that our insurance carrier, medical malpractice insurance carrier, we have been doing some locum tenens arrangement under Dr. Morrow's previous coverage with Dr. Shelley Alexander, VCU Family Medicine, and to cover us. But we've reached the limit, so to speak, of our continuing, sort of like continuing resolutions, I guess in Congress or something. But at any rate, it's going to run out May 20th. So this presented us with some particular challenges, some easier and some hard to deal with this. But we're very pleased that Amy's been able to coax Dr. Morrow into coming back and working as a temporary part-time employee to continue his medical malpractice coverage, and that'll extend through July 1st when Dr. Silvernail comes on board. So we're very thankful that Dr. Morrow, I guess he just got in from an extended vacation, very pleased that he's willing to do that, and we'll talk more about that in about hours and so forth in closed session. So Dr. Morrow, if you're out there listening, thank you very much. We'll look forward to having you back on board in a different limited capacity. So, does anybody have any other questions or comments about that? Okay, we'll move on to Health Director's report. Amy Haddam.
Well, I just wanted to follow up on some of the positions that Marcia was mentioning earlier that we did present as part of our budget presentation last week to the commissioners, just to let you know what we did ask. With infant mortality being your top priority that you chose for us to work on in the next few years, we did ask for 2 infant postpartum home visiting nurses. And our rationale behind that, home visits are more likely to help women have better overall health, more likely to encourage them to breastfeed, newborn parenting skills, they would actually be able to probably improve upon them. Less postpartum depression. There's just so many benefits of the nurse being in the home and being able to even do an environmental scan of the home, recognizing if there's any issues that need to be rectified within the home. We currently have 2 part-time retired nurses who are providing this service now, but they can only reach a portion of the population. And these home visits are conducted for at-risk women or women that are Medicaid recipients. And right now in Pitt County, more than 60% of women who give birth are Medicaid recipients. So that puts us at about 1,000 home visits that we could be doing if we had the staff to do that. And the temporary part-time retirees are able to do that, but only very small scale. So that was the rationale for us asking for these 2 full-time nurses. And the cost of that annually would be $135,948. But in time, probably after the first year or so when they build their caseload, it should be able to sustain itself with being able to bill Medicaid for the home visits. It's about a reimbursement of $120 per home visit. Not sure, as Commissioner Colson was saying, the budget is extremely tight. Not sure that that will be approved by the commissioners, but that is one of the asks that we put out there. Also, in following up with infant mortality, we did ask for to sustain 2 of our outreach workers. If y'all recall at our retreat, we did discuss that the grant that was funding these 2 outreach workers who are an extension of our social workers. We've had that grant since 1995. The state chose to go with newer projects, newer evidence-based programs. They did not fund us as well as some of the older projects across the state, even though our program has done very well. The babies that have been enrolled in this program have thrived. The mothers have thrived. Pregnancies have been spaced, hopefully, preventing repeat pregnancies and helping women to delay pregnancy until they're ready for it. So we did ask to fund that program. It would be 2.8 outreach workers at a cost of $80,270 annually, and that includes operating. So a very low-cost program, but there again, not sure if it will be included in the budget, but we did put that out there. We also asked for a 0.8 dental assistant that could assist our full-time dentist. If you know, last year, if you remember, We were kind of in a pickle because our contracted dentist had retired, and we were looking for a dentist, but we were not having any luck. We were able to get the commissioners to approve a full-time dentist with benefits, and then we did have some luck recruiting Dr. Kimberly Vincent, who came before the board a few months ago to introduce herself. She has really hit the ground running. She is seeing probably about 50 students per week through Smile Safari. You know, the units moving around from school to school. That is an increase in what was being seen before because she is there full-time. However, with the increase of students, she needs some help. So we did ask for that dental assistant to be able to join her team and to help her see the students. And many of these students, they've never had any dental care. So we're really pleased that they're able to be seen through the mobile dental unit. And that's another low-cost program. Around $20,469 is what we were asking from the county. And according to Marcia's calculations, we would be able to make up the difference with Medicaid reimbursements. So, I did want to update you that we did follow through with especially our infant mortality focus and asking for those positions. That's all I have for the health
Okay.
service report. Everything else will be in closed session.
All right, does anybody have any questions for Amy? All right, thank you very much for that. Is there any other business to discuss? Okay, we'll need to go into closed session. We have one of our resolutions that,
Okay.
okay. Do we have the resolution to read to go into closed session or?
I did not bring the closed session. I did not. She's going to look that up.
I'm sorry.
The language you need for closed session, she's going to bring that.
Okay, all right.
The last time. I can go and be passing these out while Betsy provides the
Okay, yeah.
language for you. These are the minutes. Actually, there are two items here. The minutes from the April 9th closed session meeting, as well as,
We're still broadcasting. We're still broadcasting.
no. You know, Mike, are we still broadcasting? Did Carla cut us off?
A6, a motion, is a motion to go in, is there a motion to go in closed session?
So moved.
Or second? All in favor, say aye. Aye. Any opposed? All right, we're in closed session. I'm glad you want to continue, man. Good deal.